Hello and welcome to Cocoa Pods, a podcast of the Birth Center for Natural Deliveries Foundation. We're recording from Forsyth, Georgia. My name is Dr. Bola Sagadi. Today we'll be talking about the silly things, yes, the silly things that women can do in and around pregnancy that can affect them or their unborn child. We're fortunate to have with us today Mrs. Charneika Brown. She's a mother, she's a wife, she's a nurse practitioner, and the first lady of a church. She has been through pregnancy twice and comes with a wealth of experience to talk to us about these issues today. Welcome, Mrs. Brown, to our podcast today.
Thank you so much for having me, Dr. Bola.
Thank you. You've been through pregnancy twice indeed.
Yes.
Can you speak to us about your experience, just, with the joy of having your two girls and some of the things that you had to do in your pregnancy?
Well, I will say pregnancy was absolutely the most beautiful, empowering experience I've ever had in my life. But having experienced it twice, each one was very different. So first pregnancies, you're very excited. It's all new. It's all new information. You buy every book. You ask everyone for advice. You follow all the rules. And the second one, it was just a little bit different, and all the information had changed, even in a very short period of time. I would say my pregnancies were wonderful. My birthing experiences were superb. I had a really great support system. My husband, my family, my physicians, everything was perfect. Even in the childbirthing experience, I know we'll get to this a little bit later on in the cast, but, just planning my birthing experience ahead all the way down to what type of medications I wanted, if I wanted a natural childbirth, or, what are my limits and how far I was willing to go with the delivery of my children. Beautiful experience. I have no complaints. I don't know if we'll actually cover this, but I can say I'm a successful breastfeeding mom. I think that was one of my greatest accomplishments. So 2 children, no formula ever, not one day. So pregnancy was just very empowering, and motherhood has been equally as rewarding.
Wow, thank you. Yeah, a lot of women brag about the ability to breastfeed their babies. So that's a great accomplishment. So, I was telling you, I once had a client that came and basically came in and said, Dr. Sagadi, I'd like to have some red wine in pregnancy. She was pregnant. And I told her about some of the risks of alcohol in pregnancy and why I didn't want her as her physician to use alcohol in pregnancy. And she was young and she said, well, my friend said red wine in particular is good in pregnancy. And I went further to explain, some of the effects of alcohol on her as a mom, an expectant mom, and on her unborn child. And then she went on to say, well, and I told her no, she couldn't, I would advise her not to. And then she went on to say, well, I was told that this particular brand is good in pregnancy and doesn't affect your baby. And we had a discussion again, and I said no again. And she went and said, well, what if I have just a glass? And I looked and said, well, I've said no. You've asked me this question 4 different ways, and I've said no every single time. How can someone like me communicate effectively to patients, especially young patients, about some of the risks, for instance, with alcohol use in pregnancy?
Well, I think the conversation really starts with just helping condition a person's mind to understand exactly what their role is in their pregnancy. Essentially, your body is a reservoir. You're harboring the life of another person. Another person's every development depends on what you take into your body or your environment. I'm one that I always say, pregnancy is not just something that you have to prepare for with maternity clothes and baby clothes and things for the baby to get here, but you have to prepare yourself financially, physically, emotionally, spiritually, to be able to carry that life inside of you. And, some of the sacrifices that you make come with things such as taking in alcohol. Yes, your friend might say it's okay, but if this means the difference in me having a healthy, whole, fully developed baby or not, then I probably can postpone that drink for a little while. So just educating women on what that sacrifice entails and the long-term rewards, I think is a big deal. I know sometimes we can bend the truth to be what we want it to be. But the reality is, you are carrying a life that depends on you to make wise decisions. And making those decisions can be the difference in a healthy, whole child or a child that has permanent damage because of something that you did.
Wow, wow. I know you talked about some of the things women can do in preparation for the pregnancy. And can you elaborate on that for us?
Absolutely. So, and I will preface this by saying that I know every pregnancy does not occur in a situation where we're prepared for the pregnancy. So, that being said, as women, there are certain things that we have to do, whether we're getting pregnant or not, or planning for it, taking care of your body, having routine physicals, wellness exams, gynecological exams. If you've been exposed to sexually transmitted diseases, treating those timely, and just keeping track of your overall health. Certainly, if you have any pre-existing conditions such as diabetes, heart failure, hypertension, those things can impact your ability to have a safe pregnancy journey or a successful pregnancy even. So addressing those issues before pregnancy is ever a conversation is definitely the way to go. Also, I would say if you're planning to become pregnant, going ahead and starting those prenatal vitamins and not just doing it on your own or, ordering pills off the internet, but consulting your physician, because if that's a journey that you're going to take, you need qualified medical supervision to take that journey. And, for so many people, the perception is that, well, pregnancy is something that we've done for generations and we did it without doctors back in the day. Yeah, we did. But now we have more knowledge and, more assistance through that process so that we can enter into it educated, so that we can have a successful pregnancy journey. So, taking care of yourself, wellness checks, dental care, just your health in general, vaccinations. A big one right now is the COVID vaccine and whether it's actually safe for pregnancy. And now I'm happy to say it's been found that the COVID vaccination is safe for pregnancy, which is great, not just for the mother, but also for the unborn child, because now we know that that vaccine actually provides the unborn baby with antibodies as well. So that helps them fight the COVID virus as well. So tending to those things before pregnancy is ever on the table is always a great option.
And I know some women have said that the COVID vaccine could lead to infertility. And then we know that there has been no evidence that getting the COVID vaccine leads to infertility. And, just on the physical part of things, even for women that don't have a lot of resources, if you were just to get your body physically ready for pregnancy, what are some of the things that doesn't involve a lot of money that you could be doing?
Proper nutrition, exercise, regular exercise, managing your weight. I don't think people realize the impact that being severely over or underweight may play in your ability to carry a pregnancy to term safely. So managing your weight, getting proper rest. What else? Let's see. I would say rest, managing your stress. That's a biggie. Those things are free. Now, eating is not free, but but eating properly is something that you have to make a decision to do whether you're going to have a kid or not. So doing those things, I would say, are the first steps.
Wow, wow. And, there are other things, once you've done all these things to prepare for pregnancy, you are taking the right kind of nutrition, the right kind of medication, you are doing the right kind of exercises, you're losing weight, and you actually do get pregnant. One of the things we advocate is that for women to have early prenatal care and regular prenatal care.
Right.
Because I see from an OBGYN's point of view, if something were to go wrong, because you are in front of a provider frequently, it's more likely that those things will be identified and managed. You agree with me on that?
Absolutely. Just having that relationship with an OBGYN that you trust, that's also a big thing, because again, now that we have social media and, information is just readily available. Dr. Google solves lot of medical problems and creates a lot of them at the same time. So being able to get that information from a trusted, reliable source is very helpful, as well as identifying things that may be problematic. They may not be problematic, but they may be something that you have to watch a little bit more carefully. Even myself, and I hope you don't mind me sharing, but with my second pregnancy, my daughter, some of my markers were a little bit abnormal very early in my pregnancy. And so, although it didn't translate into any health problems with my daughter whatsoever, it did require that I had to be, more closely monitored during my pregnancy, just so that, if anything came up, my doctors were already aware. So, establishing that relationship, early prenatal care, because, the bulk of the development of the child takes place very early in pregnancy. So those early prenatal screenings, early screening to know if you have diabetes in your pregnancy, that's a big deal. African American women, watching that blood pressure, preeclampsia is something that we tend to see a lot more than other populations of people. So, monitoring for those things and other complications early on can help you be better prepared if those are things you're going to face, but also if there's a way to avoid those complications and you can get in front of it if you're already, on track and in routine of having good care.
And some of the women, when they come for their prenatal visits, they say something like, well, my doctor or my provider didn't do anything. They just did my weight and my blood pressure. And, prenatal visit, getting the weight, the blood pressure, the vital signs, those are so many, such important things that have to be done in a prenatal visit. So when you went for your prenatal visit, you went with a trusted physician. It was not a scary experience.
Right.
And, what are some of the things that were just routinely done?
They always check your urine. They want to test for any type of vaginal infections, sexually transmitted diseases. At certain points, they're doing lab work to make sure that the hormones that you should be replicating in pregnancy are at appropriate levels, which are going to be important for the development of your baby. They're also checking for, thyroid disease, any other type of abnormalities, HIV and AIDS, herpes, multiple things. So, sometimes it's blood work that they're checking. Other times it may be a finger prick, not necessarily a lab collection, but those vital signs that they're checking are just that. They are vital. So, at certain points, they're checking ultrasounds of the baby. But for the most part, it's just monitoring you and ensuring that you're on track during your pregnancy, which doesn't seem like a lot, but it is a lot. And it's very important. So keeping those visits consistent and you being mindful of, what's being monitored for you, so that between those visits, if you're noticing things that are abnormal, or maybe your weight isn't tracking appropriately, or you're not feeling as well as you should, or you're not able to eat enough, those are things that you need to be able to share with your physician, because that may alter the course of your treatments when you're coming to your routine prenatal visits.
Wow, that's important. And now, even now with COVID, there is also telehealth obstetric visits in which we call the patients. At times when they have the ability, we can see them on the call, like a video call. We can look at their faces, see if it's swollen. We tell them to show them their hands and to show us their hands and their feet. We can have them. There's so many devices now that you can use to record your blood pressure at home that are fairly accurate. And then we can just ask about symptoms. How are you feeling? Is your baby moving? Do you feel your baby move? So even with the advent of COVID, we're still able to continue prenatal care in a different way. So for a woman that decides to skip her prenatal visits, what advice? And I know women skip the visits for so many reasons. There's a lack of transportation, or I couldn't get off work, or what advice would you give the women, and what is really the implication of doing this?
So my advice on skipping prenatal visits: don't. As a mother, and especially if it's your first pregnancy, this may be more of an issue, but if you've had a child before, not so much. As a mother, we wear many hats, as I said, in the beginning, but you have to prioritize. So not being able to get off from work that could be the difference in, something being wrong with your baby and you not knowing it for another 2 months. So, you kind of just have to prioritize. And I do understand that sometimes certain circumstances are beyond your control, but just making that a priority, that is your lifeline to your baby until your baby is here and safe in your arms. So not skipping the visits. If you must skip a visit, still reaching out to your doctor, call them. Telehealth is an option now, whereas previously, we didn't really have that option, but you could always call the nurse and maybe leave them a message, well, I had this concern, or could you give me a call back? Even a phone call is better than no visit at all, because that is your lifeline to your unborn baby until they're here. And in some cases, it may be the lifeline for yourself until you safely deliver that baby. So try to avoid skipping those visits.
Oh, wow. We did talk about alcohol consumption. There are other substances that women could use in pregnancy that could be dangerous both to themselves, because a woman who is consuming alcohol in pregnancy and, for instance, driving a car,
right,
puts not only herself and her baby at risk, but also the other drivers on the road at risk. And there are other substances that women use in pregnancy. I know, for instance, marijuana, a lot of women use, and they give the explanation that it helps with nausea. But we have found scientifically that it can be harmful to both the mother and the baby. So what is your advice on women using other substances like tobacco, marijuana in pregnancy?
Avoid them. Just as even with some holistic remedies, avoid them. Many of these substances, of course, we know cocaine is not, going through the FDA to say whether it's safe and effective during pregnancy. Avoid that. But there are even some holistic remedies that they're not FDA approved. They're not tested in women. And though even if you can't pinpoint the difficulties that may come behind using them, again, you are the lifeline for your unborn child. And so avoiding those substances at all costs is definitely very important, not just because of the damage that the substance could do, but just like you said, you could have a car accident because you've been smoking marijuana and you're inebriated and, you can't make quick, safe decisions, or, you could fall, stumble. We're talking about methamphetamines, many substances. All of these are harmful to the baby. Even some safe medications that you are able to use outside of pregnancy can actually cross the placenta and be harmful to your unborn baby. So keep that in mind, which is why it's also so important to be in close communication with your physician, because they can advise you on these matters as well.
Now, you talked about people like getting prescriptions off the internet. Can people, what is your advice on self-medicating? Because,
Don't.
Yeah, because, people say like, my friend said I could use this and.
These friends, if it doesn't come from a doctor, I don't want to hear it. And, so when I was pregnant, I was blessed because my physician actually had an approved list of medications that are safe for certain things that may come up, on average in pregnancy, and, when you needed to call them instead of self-medicating. I think that's very useful. I also think this is where those prenatal classes come into play, and, good prenatal visits, because that communication can be the difference in whether you're doing things that are actually harmful. So avoiding even standard medicines that you would say you could just take. Well, I'm nauseated, let me pop one of these. No. You don't know the damage that, that could do to your unborn child, or how it could affect your pregnancy going forward. So avoiding those things.
Wow. And I know some of the things we were going to talk about was stress management and proper rest. And I've had patients come to me like, I have 3 jobs, I can't. What are you talking about? Proper rest? I have to make income, or I'm the sole breadwinner for my family, and like you're not being realistic. How can a very busy woman that truly, number one, needs the income, needs the resources, and number 2, has to take several jobs just to be able to make ends meet, how can she manage the stress? How can she get proper rest? Or somebody that has already 5 other children at home, what practical tips do you have?
Oh, that's a biggie. So I'll just say prioritize. Not to say you'll get 8 to 10 hours. I don't know if I've gotten 8 to 10 hours of sleep since I have had children. So women, we just find it, just make it happen. But at the same time, these are priorities where it kind of goes back to proper planning before pregnancy as well. Because myself, okay, I'm a busy career woman. I know that we have a lot going on. My children are at an age where they need me in a different capacity right now. So before I consider another baby, I have to consider my current obligations, because that pregnancy is going to require things out of me, but that baby is going to require things out of me as well. And if I can't give them, then that's a consideration before taking on another pregnancy. But, that's kind of like water under the bridge once you're already pregnant. I would say just try to prioritize as best you can, even if you can slide in a few minutes of something to help you relax and unwind. If you do work multiple jobs, make sure that you're eating properly. Make sure that when you are working, that you're taking enough breaks, that, it's not the type of work that will be harmful to your health in pregnancy as well as to your unborn child. And just making sure that you have enough of you to give yourself, your unborn child, and your family that's already there. That's a matter for you as well. So prioritizing, that's all we can do as women.
Wow, wow. And your career to becoming a nurse practitioner was probably long and tedious, a lot of hard work. And how did you just cope? If you were going to give advice to, a career woman that wants a family at the same time and that wants to keep her family, how do you balance these things out?
For me, priorities, I always enter everything with prayer. So those that have a spiritual foundation, if you don't have one, I encourage you to have one. If you have one, I encourage you to build it up. Because for me, it was prayer. So I knew that I was a nurse before I was a wife. That was my first career. And then I became a wife. I took a break from pursuing further avenues in my nursing career to get my feet wet in marriage and kind of figure out what I needed there. And then it was time to take on motherhood. I was actually pursuing my Bachelor of Science in Nursing at the time that I became pregnant with my first daughter. So completed my bachelor's. I took a break because I knew I wanted to give my undivided attention to my children. And so my second daughter came shortly after my first. And then once I got everybody out of diapers and, out of my bed, except for one person, I went back to school. But I couldn't do that by myself. I had a village. My husband was a very strong supporter of me going back to school. My children, who were only, I think my baby girl was like 18 months and my oldest was 3, when I entered into the program to become a nurse practitioner. And of course, we had a strong village around us, but I actually made changes on the type of work that I was doing at the time, just so that I could make the accommodations for the amount of work that I was taking in with my career, so that I could have enough time to study, have enough time to give to my children. I was still nursing my youngest daughter at the time that I was entering into the program. And so I still had to make time for that. And so, I say keeping your priorities. My career has always been a priority in my life. It has never been the main priority in my life, but it has always been very important. As a woman, I think it's always important for our children, especially if you have daughters, to see you be productive outside of just being a mother, because even if motherhood is your career, that's fine, but they got to see you find something that you're passionate about and do that. And I think that's important for the balance as well, giving you some of you as well. When I first came to the practice, I'm blessed that my doctors all support family. And so prior to COVID, I would bring my daughters to work with me periodically just so they could see what mommy does all day, and they would have a better understanding of what my day consisted of outside of cooking and cleaning and homework and picking up and dropping off and, those things. And that actually helped my daughter to have more patience with me when I was home in the evening, because it's like, okay, now I see why mom was tired in the evenings. And so that was one of the things for me, balance. But, sharing your experience with your family, whoever your village consists of, I think that's a biggie, because if you all know what you're working toward, you can work together. But if you're just kind of dealing with everything on the inside, nobody knows what you're going through. I still have periods where I'm very overwhelmed, and I'm grateful that my village can allow me to take a step back sometimes when I just need to be there for myself a little bit, and they allow me that. that. So I encourage you to have a strong village around you, support system that you can trust, that you can love, that can support you in your high and your low points, because you will have them, especially as new moms. I don't think we talk about that enough.
Wow. Wow. I am just in admiration of everything that you've said, because having been and still being a working mother myself, I fully understand what you're talking about. It's funny because some of the working moms come up with technologies now, like they have hands-free breast pump. They can do their work, perform their surgeries or take care of their nursing, and they're breastfeeding. They have all these silent breast pumps that, you can go about your day. So it's funny the way technology is even helping us to really multitask and do all these things that we do.